Yes, I'm really happy about this session. So it's focused on antimicrobial resistance and new product innovation. And we chose that because it's a really important area. The field is gaining momentum and really thinking comprehensively about antimicrobial resistance and all of the different tools in the toolkit and skills required to address it. This is well embodied in the recent UN General Assembly high-level meeting on AMR that has a great declaration stating, it's got to be all of us in it to end it. And that's part of the reason that we selected that as our focus. It's so important, it's so high impact. It's going to take all of us to address it. And then we have core expertise at Parexel in antimicrobial development, both in direct-acting antimicrobials, monoclonals, vaccines, and then novel modalities like bacteriophage and microbiome. So it's an area of real importance. Where there are products in development, where there are new modalities, and we have active experience in that space, and a real expert on our team in Alexander Urasovich, who is our head for antimicrobials. Oh, it's actually really important because we're doing new things, right? So you can see, the pace of innovation tracks with the amount of regulatory innovation, right? So in COVID, we needed new tools quickly while still demonstrating definitive evidence of safety and efficacy. And this is where you got the adaptive and seamless trials for the vaccine space. And so vaccines for AMR, again, the regulatory partnership is really important. There's lots of novel designs, again, adaptive and platform for vaccines for AMR, but then also for the other interventions. And then some of the interventions are first in class, right? So bacteriophage, that's going to require extremely close partnership with regulators to know how to test it and what definitive evidence is. So I think staying really close to the science is important in antimicrobial resistant, new tool development, and then also close and collaborative partnership with regulators. I mean, my roots are in infectious diseases. I'm ID trained, it's where my heart is. And I did my postdoc in immunology, and I've been in immunology for the past 15 years because I think immunology is where many of the answers to ID lie. Whether it's discoveries about the microbiome, that by RNA we're more microbe than host, how the microbiome conditions our immune response, trains and sort of educates our immune system. I just think that the scientific frontier for ID is much of it will be immune-based. So that's kind of a trend in the sense that I've thought that for the past 15 years. And now we're seeing immunology, come well beyond immuno-oncology into inflammatory diseases like rheumatoid arthritis and lupus. The trends are really understanding the critical role that the immune system plays in turning an infection into a disease. And then I think the other trend is thinking well beyond antibiotics, right? There's direct-acting antimicrobials, they're critically important, they have an essential role, and there's a lot more to do beyond them. And it's a lot more to do just beyond antimicrobials and vaccines. It's also monoclonals, bacteriophage, direct, antimicrobial peptides. There's just a lot of innovation and 21st century mindset that needs to come into ID.